Welcome back to Metta Health Talk. Today, we are discussing a topic that is often considered safe sex, but medically, that is not entirely true. We are talking about oral sex. Many people believe that because there is no risk of pregnancy, oral sex is risk-free. This is a myth. While it has massive psychological and physiological benefits for intimacy, the mouth is a mucous membrane. It absorbs bacteria and viruses just like the genitals. Today, we will analyze the pros, bonding, orgasm rates, and the cons, throat cancer, herpes. We will teach you how to enjoy intimacy without compromising your health. Let's start with the positives. Why is oral sex so important for relationships? It bridges the orgasm gap. Studies show that during penetrative intercourse alone, only about 30 to 65% of women reach orgasm. However, with oral stimulation, cunnilingus, that number jumps to over 80%. Why? Anatomy. The majority of the clitoris is external. Oral sex provides the direct, consistent stimulation that penetration often misses. For men, oral sex, fellatio, offers a different type of sensation and visual intimacy that can be crucial for maintaining desire in long-term relationships. Medically, sexual satisfaction is linked to lower stress and better heart health. There is also a chemical benefit, bonding. Oral sex is an act of vulnerability. It requires trust. This vulnerability triggers the release of oxytocin, the cuddle hormone, in both the giver and the receiver. For the giver, the act of pleasing a partner releases dopamine, reward. For the receiver, the sensation lowers cortisol, stress. Some controversial studies even suggest that seminal fluid contains mood-enhancing hormones like prostaglandins and small amounts of serotonin, which might be absorbed through the mucous membranes of the mouth, potentially reducing depression. Though the science on this is still debating the scale of impact. Now the risks. The mouth is dirty. The genitals are dirty. When you mix them, bacteria travels. 1. Gonorrhea and chlamydia. These bacteria love the throat. It is called pharyngeal gonorrhea. It is often asymptomatic, silent. You might just have a mild sore throat, but you can pass it back to your partner's genitals or to a new partner. Untreated gonorrhea in the throat is harder to cure than genital gonorrhea because antibiotics don't penetrate throat tissue as well. 2. Syphilis. Syphilis sores, chancre, can appear on the lips or tongue. It is highly contagious through oral contact. This is the most serious long-term risk. HPV, human papillomavirus. We usually associate HPV with cervical cancer, but HPV also causes oropharyngeal cancer, cancer of the back of the throat, tonsils, and tongue base. In fact, HPV is now the leading cause of throat cancer in men, surpassing smoking. How it happens? If you perform oral sex on a partner who has high-risk HPV, even if they have no warts symptoms, the virus enters your throat cells. Decades later, it can mutate into cancer. Men are statistically at higher risk of getting throat cancer from performing oral sex on women due to the viral load in cervical fluids. Prevention. The HPV vaccine protects against this. If you're under 45, get vaccinated. Another major risk is herpes. There are two types, HSV-1, oral cold sores, and HSV-2, genital. However, today, the lines are blurred. If you have a cold sore on your lip, HSV-1, and you perform oral sex, you can give your partner genital herpes. Conversely, if your partner has genital herpes and you perform oral sex, you can get oral herpes. The rule: if you see a sore, a blister, or feel a tingle on your lip, do not perform oral sex. Herpes sheds the virus even before the blister appears. Viral shedding. It is incurable. Once you have it, it stays in your nerves forever. How do we make it safer? 1. Hygiene. Both partners should wash their genitals with warm water and mild soap externally before the act. This reduces surface bacteria, like E. coli from the anal region, that could cause throat infections or UTIs. 2. Barriers. Condoms. For fellatio, on a penis. Flavored condoms exist specifically for this. Dental dams. For cunnilingus, on a vulva, or analingus. A dental dam is a thin latex sheet that acts as a shield. If you don't have one, you can cut a condom open to make a flat sheet. Most people do not use these barriers for oral sex, which is why throat STI rates are rising. If you have a new partner, these barriers are non-negotiable until test results are clear. To conclude, does oral sex have pros or cons? Pros: it builds intimacy, boosts pleasure, relieves stress, and helps bridge the orgasm gap for women. Cons: it carries a real risk of STIs and throat cancer if practiced unsafely. The verdict? Enjoy it, but be smart. 1. Get vaccinated for HPV. 2. Get tested for throat STIs. Swab test if you have multiple partners. 3. Check for sores before engaging. 4. Maintain good hygiene. Sex is a beautiful part of life, but biology doesn't care about romance. Biology cares about viruses. Protect yourself so you can enjoy the pleasure for a lifetime. Thank you for joining this masterclass on Metta Health Talk. If this video helped you understand the risks and rewards, please subscribe. Stay safe.